Today, we will discuss a condition known as Polycystic Ovary Syndrome, commonly referred to as PCOS. Contrary to its name, cysts are not actually present in the ovaries. Instead, polycystic ovaries contain a multitude of harmless follicles, each roughly 8 mm in size. These follicles are responsible for holding maturing eggs. For women diagnosed with PCOS, the follicles frequently fail to release eggs. This insufficient ovulation can present hurdles for those trying to conceive. It's challenging to estimate how many individuals are affected by this condition, but PCOS appears to be quite prevalent, especially in areas like the Middle East, South Asia, and Southeast Asia. Interestingly, over half of the women with PCOS might not show any visible symptoms. There are three primary features of PCOS. The first is irregular periods, which suggest that the ovaries do not consistently release eggs. The second involves elevated androgen levels, which can lead to unwanted facial or body hair. The third is the presence of polycystic ovaries, recognizable via ultrasound, showing enlargement and fluid-filled sacs. Importantly, true cysts are absent. If you exhibit 2 out of these 3 characteristics, you may receive a diagnosis of PCOS. Most individuals are born with this condition, though symptoms typically surface around puberty, and many may not realize it until their 20s. The symptoms of PCOS can differ greatly and are often overlooked. This condition can also affect metabolism, resulting in easier weight gain and more difficulty losing weight. Managing PCOS may feel overwhelming. However, understanding its health implications and available treatments can empower women to regain their well-being. This syndrome mainly affects women during their reproductive years and can influence many aspects of daily life. Irregular periods can frustrate many women as they become routine. Additionally, unwanted hair growth may impact self-esteem and mental well-being. It's vital to view these challenges as medical issues rather than personal shortcomings. PCOS symptoms usually arise in late adolescence or early adulthood, though not every woman experiences all symptoms. Severity can range greatly. PCOS is a major factor contributing to female infertility. Many discover their condition while trying to conceive. In a typical cycle, an egg is released every month. However, for women with PCOS, ovulation can be irregular, resulting in missed periods and complicating conception. Living with PCOS may increase the risk of various long-term health issues, such as type 2 diabetes, mood swings, and depression, often associated with self-esteem difficulties, elevated blood pressure and cholesterol, raising the chances of heart disease and stroke, sleep apnea, particularly among those who are overweight, leading to disrupted sleep and a heightened risk of endometrial cancer, especially in women with infrequent periods over time. Even with a lower overall risk of endometrial cancer, treatments that help regulate cycles, such as contraceptive pills or an intrauterine hormonal device called Mirena, can reduce this risk. Hormone tests such as LH, FSH, and male hormones might be necessary to determine if excess hormones stem from PCOS or another imbalance. An ultrasound can detect a greater number of follicles in the ovaries, indicating polycystic ovaries. Blood tests will evaluate hormone levels, diabetes risk, and cholesterol levels. A diagnosis of PCOS typically occurs when other potential causes for similar symptoms have been ruled out, along with meeting 2 out of the 3 of having irregular or infrequent periods. Abnormal blood tests showing elevated male hormone levels, like testosterone, or showing signs of excess male hormones regardless of normal blood results, or ultrasound confirming the presence of polycystic ovaries. Meeting just 2 criteria makes the diagnosis, and an ultrasound may be normal. After diagnosis, factors like age and weight may necessitate regular monitoring for blood pressure and diabetes. While PCOS is a lifelong condition, it can be effectively managed. Treatment approaches vary because women with PCOS experience different symptoms or just a few. Here are the primary treatment options discussed in detail. For those with excess weight, losing even a small amount can significantly alleviate PCOS symptoms and reduce long-term health risks. A weight loss of 5% can provide notable benefits. Determining a healthy weight through BMI calculation is essential, with the healthy range being between 18.5 and 24.9. Tools like BMI calculators can help assess your status. Weight reduction can be achieved through regular exercise and a balanced diet, full of fruits and vegetables, whole grains and lean proteins such as chicken and fish. Medications can help relieve various PCOS symptoms. For irregular menstrual cycles, contraceptive pills are commonly recommended to promote regularity. Alternatively, progestogen hormone tablets could be prescribed intermittently to induce periods every 3 to 4 months, lowering long-term cancer risk linked to infrequent periods. Hormonal contraceptives in the womb, such as a Mirena, can maintain a thin womb lining, even if they don't always trigger periods. For women facing fertility challenges, clomiphene is usually the first-line treatment for those hoping to conceive. Clomiphene stimulates the ovaries, encouraging monthly egg release. If it does not induce ovulation by itself, doctors may recommend metformin. Commonly used for type 2 diabetes, metformin aids in lowering blood sugar and insulin levels in PCOS patients. Besides helping with ovulation and menstrual regulation, metformin can offer long-term benefits, such as reducing cholesterol and minimizing heart disease risks. Metformin is safe, but it is not officially approved for PCOS in many countries. Be aware of its possible side effects, including nausea, stomach discomfort, and vomiting. If taking metformin for PCOS without plans to conceive, effective contraception is crucial. Letrozole serves as another option to stimulate ovulation, acting as an alternative to clomiphene. Initially approved for breast cancer treatment, it's also used off-label for PCOS. Doctors may consider unlicensed drugs when they believe the benefits outweigh potential risks. If oral medications are ineffective for conception, gonadotropin injections might be advised. Nonetheless, these injections carry a higher risk of overstimulating the ovaries, resulting in multiple births and less commonly used. Excess hair growth and loss can often be managed with a combined oral contraceptive pill. Eflornithine cream offers a temporary solution for unwanted facial hair, although it won't eliminate it. Improvements may be noticeable within 4 to 8 weeks after beginning treatment. Eflornithine availability can vary. Other methods to cope with unwanted hair include plucking, shaving, threading, creams, or laser treatments. For excessive hair loss, other anti-male hormone medications like cyproterone acetate, spironolactone, flutamide, and finasteride could be effective. However, these treatments aren't appropriate for pregnant women or those attempting to conceive. For women experiencing hair loss from the scalp, doctors might suggest minoxidil cream, which isn't safe for pregnant women or those planning to become pregnant. Additional medications may address other PCOS-related issues, including weight loss medications like orlistat for those who are overweight and cholesterol-lowering drugs for high cholesterol levels. If medications prove insufficient to get pregnant, in vitro fertilization or IVF might be explored. IVF involves retrieving eggs, fertilizing them outside the body, and reintroducing them to the uterus, often increasing the likelihood of multiple births for women with PCOS. Surgical options exist as well. A minor procedure known as laparoscopic ovarian drilling can resolve infertility challenges that haven't responded to medication. Under general anesthesia, the gynecologist makes a small incision in the abdomen and applies heat or a laser to the ovarian tissue, reducing male hormone production. Pregnancy may pose higher risks for women with PCOS, including hypertension, preeclampsia, gestational diabetes, and miscarriage. These risks often rise with obesity. If you are overweight or obese, aiming for weight loss before conception can significantly diminish these risks. If you like our today's video, consider subscribing our channel for more informative videos related to women's health.